organized by West Bengal AHA, organized by WBAHA in conjunction with WAP and Central AHA. And I think it's very relevant because what's happening in our state makes our issue, I think, more relevant today. And we've got a very illustrative and dignified dignitary, Dr. Chandrika Rao, who's supposed to be one of the masters in medical law and ethics, to deliver this lecture. And we hope to have an interactive lecture. Before she starts on this journey on POCSO, I would invite our chairperson, our very own Dr. Geeta Patil, to say a few words.
Sir, before me ask Dr. Atanu sir, IIP.
Please, yeah.
Atanu,
if you can just start the proceedings from Central.
Geeta ma'am, you start, I will follow you. Geeta ma'am, please.
Thank you very much, Ashim Kumar.
We are eager to hear your words.
So, sir, it is really, this is the appropriate topic selected in the present situation. All of us, we know this POCSO Act was introduced in 2012 to create a robust legal framework to protect the children from sexual abuse, harassment, exploitation, because we are seeing the rising cases of the child sexual abuse. There was lack of proper legislation and child-friendly, age-appropriate, all procedures should be there. And apart from that, we know that it should be very sensitive. And mandatory reporting is an issue which Chandrika Rao will definitely elaborate. And this is mainly done to address the gaps in the existing laws. But have we achieved? So there are so many things are still to be done. The age of consent, maybe legal. I think I remember, Chandrika, last time you told we have to follow the law. So age of consent is going to be always an issue because of the 16 years, 18 years, consensual sexual relation. Modifications are required. And experts like you, Dr. Chandrika, is the right person because she has worked with this topic and she might have dealt many cases and she's aware about the practical circumstances and how to implement, create awareness. And still we have got one worry about delay in a justice. Chances of false allegations are worrying us. Are we going to have a
I would request everyone to mute themselves except the speaker. Please mute yourselves.
And Dr. Chandrika is the right person to ask the question whether we are taking care of digital and online offenses in a proper way, because that is increasing. Sexual offenses in a digital platform is increasing. So I thank West Bengal Adolescent Health Academy for giving me opportunity to express, to tell about the importance of this topic. And let us not waste time. I think I will hand over back to Dr. Ashim Kumar Ghosh. Let us start the session after the few opening remarks.
Absolutely. I would request Dr. Atanu Bhadra, the treasurer of Central IIP, to say a few words, please.
Thank you. And it's a very interesting topic. We had been discussing it for the last 2 to 3 years, but I must admit that we are not very comfortable with it. There are gaps in the information, there are gaps in the action, what to do. So we try to, we know that we have to update ourselves, we have to do the action that has to be followed up. But I think that's very important that today we at least cover the information gap that we have. And I thank West Bengal AHA, Dr. Ashim, Dr. Champak Das, and Dr. Shilpi and Dr. Shravani. She will be joining just now for continuing the education process on the virtual mode. We'll be looking to have a physical mode meeting also sometimes in this year. And of course, the National AHA, Dr. Geeta Patil ma'am, Dr. Shukanto sir, Dr. Prakash sir, steering it all across the country. So over to Ashim to continue the process.
I would now request our past chairperson, Dr. Shukanto Chatterjee, for his words. Dr. Shukanto.
Good evening, Dr. Ashim, and good evening, Dr. Geeta Patil Madam, our chairperson and the Secretary Prakash Arya, and all other dignitaries. I must thank Dr. Chandrika Rao to accept our invitation on a topic which I and Dr. Ashim Ghosh discussed that this could be a topic if someone is willing to talk on it. Then finally, we chose Dr. Chandrika Rao with the help of Dr. Geeta Patil, and then Chandrika immediately accepted it. Thanks to Dr. Chandrika for agreeing to be the faculty of this webinar. And I must say that this topic is something which all the practicing adolescent pediatricians are having problem at times. It's not a daily problem of like say cough and cold, diarrhea and all that. But when you come across with this issue, then you might have your hairs becoming erect or you are sweating. What to do and whether I'll be friendly with the adolescent, at the same time I'll not be caught in the law. So this is something which all should learn, and I must thank the West Bengal Academy of Adolescent Health for organizing this webinar, and thank you all the audiences who are listening to it. I will also listening Dr. Chandrika. Thank you.
Thank you.
Back to Ashim.
A few words from our secretary, Prakash sir. Kuch boliye.
Sir, the crime against children are increasing day by day. I congratulate West Bengal AHA for organizing this webinar on today's burning topic on POSCO.
Chinmay,
The
please
crime
mute
against
yourself.
children are increasing day by day. Awareness of our adolescent about the law against such crime is very important. As AHA, we were supposed to raise the flag against the crime over the adolescent. Thank you. Thank you, sir.
Thank you. Thank you. I would lastly request Dr. Champak Das would be giving the concluding remarks. The EB members, Dr. Kalpana Datto and Dr. Kripa Sindhu, just a few words before we start the program. Dr. Kalpana Datto and then Dr. Kripa Sindhu.
Good evening to everyone, and thank you, West Bengal Academy of Pediatrics, along with the West Bengal Adolescent Health Academy, for inviting me and giving me opportunity to present in this webinar. And my regards to all the dignitaries from the National IAP, like Dr. Atanu Bhadra, and all National Adolescent Health Academy, Dr. Patil and Dr. Arya, and of course Dr. Ashim and Dr. Champak Das. This protection, I think POCSO is a very important topic, but not only protection, until you give the prevention also, it is not going to stop. And there are three steps I think I will be listening from the experts: prevention, then protection, of course the POCSO, and if there is any incident happens, what to do as a medical personnel, what is your responsibility? Because every week, no, if it's not every alternate day, I do get call from my hospital every week. Okay, madam, our baby has come with some injury, or some police has rescued some kids, and what to do and wait to inform. So these things are very important to know, because we are facing day to day increasing crime against children and adolescents. So let's hear from the experts and empower ourselves so that we can give a safe and healthy adolescence and future. Thank you,
madam.
Dr. Ashim, for giving the opportunity.
And lastly, Dr. Kripa, a few words, please.
Oh, thank you, Asim. Good evening, everyone. In presence of esteemed, leaders of the adolescent health, headed by Dr. Geeta Patil, Madam, Sukanto sir, Prakash sir, and Sudhir Misra. I see presence of Dr. Sudhir Misra as well. And there are so many luminaries.
Dr. Kripa Sindhu, you are muted.
Sorry. I acknowledge the presence of Atanu Bhadra, our National Finance Secretary, Champak Da, and there are so many luminaries over here. Sudhir Misra sir is also here, I see. And obviously, we want to listen to Chandrika ma'am, who will be speaking on POCSO, and fortunately or unfortunately, this has become a real-time need of our state also. So let us listen to her and try to understand and imbibe as much knowledge as we can. Thank you, Osim, for inviting
Thank
me.
you.
Otherwise,
Our chairperson-elect, Dr. Himabindu Singh, has finally joined. So I would request Madam to say a few words, please. Madam.
Thank you, Dr. Ashim. Very, very happy to be again with all of you. Really congratulate the HA West Bengal and the IAP West Bengal, all the stalwarts of West Bengal and AHA. Sukanta ji, yourself, Champak sir, and Atanu Bhadra, everybody who's here. Congratulate all of you to do such nice activities. And today what you have taken up is the topic is very, very important. And we have a very good speaker, Chandrika Rao, and we'll definitely, I think we should spread the message all over. It's the need of the day, especially what happened in Kolkata. We're all so shaken. And I hope we really get some initiatives in a very sustained way. Because whatever we do, it only happens for a few weeks and then the emotions die down. So we have to have a sustained effort from the HA and all our authorities, IAP, so that we really have something concrete to talk about how to prevent sexual abuse and how to get in interventions in our day-to-day practice. All the whole community should be involved, and we should take a lead in this. And I hope such programs we do even at the college level and even at community level. And after we address, we are always talking amongst ourselves, and we should. I hope we do in the outreach programs also, and we outreach and work with all other organizations. Thank you, and let's listen from Chandrika now. Once again, thank you for inviting me.
Thank you for your
Thank
kind
you.
words. And lastly, Dr. Shudhit Misra, the EB member from Central AHA, sir, a few words from you before we start the program. Dr. Shudhit Misra.
Dr. Arun Sharma has also joined.
I think Dr. Shudhir Misra is not there.
He is not there.
He's not
Dr.
there.
Arun Sharma has joined.
Yeah.
Arun Sharma.
Dr. Sharma, a few words before we start our program.
Very good evening to all. Yes, sir.
Sir, a few words from you, Dr. Arun Sharma, sir.
Yes, sir. Thank you. Thank you very much. And I congratulate to the AHA West Bengal and IAP West Bengal and welcome you all stalwarts of the IAP and AHA present here to listen the very important topic. Today's scenario of the practice is different. So along with the practice, we have to save our skin first. So this is one of that webinar we learn how to save our skin from POCSO Act. I wish all the best. Thank you. Thank you very much.
Thank you. And thank you. And now we start a program. Madam, Dr. Chandrika Rao, you can start sharing while I introduce yourself. I think she doesn't need much more introduction. Madam had been the professor of pediatrics and HOD pediatrics from 2013 to 2016, convener of the medical education unit, a coordinator of the child abuse response unit, the coordinator of the medical ethics course. She was a professor of the MS Ramaya Medical College and Hospitals, Bangalore. She was a chairperson of the Bangalore Adolescent Chapter from 2014 and 15, a member of different bodies, medical and law ethics bodies. She's got numerous scientific publications, both national and international, and she's written many textbook chapters. She's got the best research papers during Adolescent 2005, 10, 14, and 22. And now over to you, madam, for your deliberations.
A very good evening to all the distinguished doctors, physicians, pediatricians, luminaries who are on the platform. And I would like to first thank the West Bengal Adolescent Health Chapter and the Academy of Pediatrics for considering me as a guest speaker for today. So thank you very much, and thank you again. And as you know, in South India, when we think of West Bengal. So usually it is said that intellectual discourse is very popular in West Bengal. A lot of debates take place, and what Bengal thinks today, the rest of India talks about tomorrow. So with that in mind, we will go ahead with discussing the Protection of Children Against Sexual Offences Act, which is the POCSO. So it was, the first introduced in 2012. However, the principles of POCSO has been there in at least 50% of it was being already followed in the centers which used to deal with child abuse. So before 2012, most of the time, the child who was abused used to be classified as query rape and used to be brought to the forensic department. The forensic department would examine just like, or the gynecologist, just like any other similar case, and they would certify it. However, there were lots of gaps and there was a deficiency felt in the services, and the government in its wisdom has brought about this POCSO Act. So in the beginning, I would like to reiterate, this POCSO is for protection of children. It in no way harms doctors. It is not trying to hold us as responsible or that we have to do something more, or we will be punished if we don't do something. It is not like that. The government is up to giving good care, and just like any medico-legal case where documentation and investigations have to be correctly done, this is the same as in POCSO. It was not very well dealt with the curriculum, even today, little less dealt, and hence we are perhaps not so comfortable with it. Also, we don't see so many cases like a cough, cold, fever. So perhaps all of us have dealt with less cases in our whole career, and that makes us a little uncomfortable. So let's go through the POCSO and make ourselves familiar with this. Oh, how do I change the screen? So to understand this POCSO Act, there is some understanding of what is child abuse also. So I'll try to stick to the POCSO Act without, deviating from it much. So we'll be talking about introduction. There are 9 chapters in the POCSO Act. What are the salient features? What is the classification? What is the actual role of a medical health professional, and all these issues about reporting, and a few case scenarios, and what are the challenges and controversies. So we'll quickly go through it. Dr. Ghosh, how much time do I have? Please tell me again.
Madam, you have got it 10, 10, 10, and then we can have some discussion
I will
at least.
try to finish before 10. I
Sure,
speak a
sure.
little fast, so we can always come back to the cases if I finish early. Yeah.
Okay.
So this is the classical definition. We cannot alter it, and hence I have put the whole most accepted definition is by the World Health Organization, which says that all forms of physical or emotional ill treatment, sexual abuse, neglect or negligent treatment, commercial other exploitation resulting in actual potential harm to the child's health, survival, development, dignity in context of a relationship, responsibility, trust or power, that is the one which goes for child abuse. And the POCSO Act is for the protection of these particular children. Now, introduced in 2012, it was introduced to also protect children from sexual assault, which is not penetrative, harassment, pornography, and to protect the child's interest throughout the judicial proceedings in the court or in the police station. Now, it started becoming effective from 14th November 2012. There were few amendments on 2019, which has been the last amendment that we have seen till now. So, in the POCSO Act has been basically planned by the government to designate special courts in the state government, and for the state government to immediately appoint a public prosecutor for the child in that particular case. There are times when we may use the word victim, and we are not supposed to use that word. We should try to just say child or patient as far as possible. Also, the POCSO Act was to monitor the guidelines. Now, each state has guidelines. We all follow, at least in Karnataka, we have also the Karnataka guideline, but we have taken it from the Central Ministry of Family and Health Welfare guideline. And most of all the guidelines are under it because that is quite exhaustive. So the formulation of the guidelines is for the NGOs, organization, professionals, experts with knowledge of psychology, social work, physical health, mental health, and child development to assist the child during pre-trial, post-trial, and to also report to the government if there's been breach of any of these guidelines. So we must remember that somebody is monitoring us. Designing and implementation of modules for especially the police and even the judges and any stakeholder. It may be an NGO, it may be a social worker, all of them require the module, and for dissemination of information through media at regular intervals. So the POCSO Act has been done for all these. Also, it calls for any report by the Child Welfare Committee, which is present in every district. And data about the sexual abuse, including the offenses, the procedures, details for arrangement of care, protection of children, arrangements for emergency medical care and medical examination. All this is collected by the government official, including what time did the patient come to the hospital, say 3 p.m. At what time did the doctor see the patient, 3:45? What time was treatment given? All that is documented in any medico-legal care, not only POCSO. Even in road traffic accident, it will be documented. Similarly, it is documented for POCSO cases also. And also the information about protection of the child by the concerned Child Welfare Committee. And all this is produced annually, reported in the Parliament. So it is an all India national protective care which has been organized under special structures. Now, as doctors, we need to know few things. The POCSO has 9 chapters, which are what are the offenses against children. Using a child for pornographic purposes means exactly what. Then abetment and attempt to commit an offense, procedure for the reporting of cases, procedure for recording statement of the child, courts, and miscellaneous. Now, as we can see, we need to know this chapter 2 very well. We need to know the chapter 5 and 6 very well. So as doctors, we need to know 3 of these chapters properly, and we can have another presentation of exactly what these chapters say, because somebody who deals with these cases should know the POCSO Act in a little bit of depth. Now, many of the time, such cases, especially when it is not penetrative, that means somebody has touched, somebody has whistled, or somebody has shown a pornographic film, or example, stalking, disrobing, voyeurism, trafficking, all that were also added in the in the POCSO Act in 2013. And most of the time, these are the cases where these are hidden by the family, and they have not brought out into the society with the so-called stigma in cultural terms. And however, if complained, there is a court procedure for it. So the salient features are that the burden of the proof remains with the accused. So the child who says that somebody has sexually abused the child need not prove that I don't have photo or I don't have a message to show that he or she has abused me. The burden remains on the person who has been accused, which is a very powerful law for the child. And this has been done by the government, thinking that usually children mostly will not misuse that particular act. Also, it is gender neutral, both in terms of the child, that means the abuse can be done on a boy or a girl. Both are coming under the POCSO Act, not only girl children. Also for gender neutral for the perpetrator. The perpetrator may be a girl harassing sexually another girl or a boy, or a male harassing a girl or boy. So even the perpetrator, the POCSO Act is gender neutral. This is very well laid out. Also, this punishment has been laid out, and the punishment is more severe when so-called protectors are the perpetrators. That means if a father does the abuse on the child, or a headmaster does the abuse on the child, or a teacher, so-called protectors, the punishment is more. And the POCSO Act has clearly laid down child-friendly measures. It has told that all police stations, or few police stations in the city and in the court, there should be child-friendly rooms. The people should be trained in the questioning techniques. There should be a female doctor for female children, and there should be child-friendly procedures in the court. After that, there has been a lot of measures taken, however, not complete. Still, there are police stations where probably child-friendly rooms are not there. So the police usually go to the residents unless the parents do not want them to come there. Also, the POCSO supports the family in terms of some monetary care. There is a coordinator who is appointed from the government, and they have made that every citizen is accountable towards child protection. Child may not come forward to complain. Child may be manipulated or told by the parents that do not complain. Hence, it is mandatory that any adult should report all cases of sexual offenses towards children to the police, and there is a punishment if it is not reported. And that includes the doctors also. It's also very important, POCSO has told that there should be confidentiality maintained in the media and press. And if the press breaks the confidentiality, anybody can complain against that person saying that they have broken the confidentiality. So coming to the core important part of the... Sorry?
Shushanto, please mute. IAP Shushanto, please mute. Except the speaker. Please mute everyone except the speaker.
Okay. So coming to this, now the next part is very important to us as doctors, whoever deals with the cases. And we need to understand these 5 terminologies proper. And most of the, or all the cases of POCSO come under these 5 headings. So the first 2 is penetrative sexual assault, and it is aggravated penetrative sexual assault. The next 2 is sexual assault and aggravated sexual assault. And the third part is the sexual harassment. So it's actually 1A, 1B, 2A, 2B, and 3, or 5 categories. Let us go quickly through them to see what exactly each one means, so that when we get a case, we know what opinion and how to manage the case. So penetrative sexual assault, I should also warn all the pediatricians that as being physicians, we should be neutral in emotional words, because these are sexual terms which are used in the law and the act. And we have taken verbatim from the act as such, and we should try to maintain neutral sensitivity. So penetrative sexual assault is when the perpetrator penetrates the penis in any part of the child, or the child has to do such an act with any other person. And also, instead of penis, if the person uses any other object in the child, or makes the child also does similarly on any other child, both of them, whether it's a part of the body which is penetrating or any other object, both of them come under penetrative sexual assault. Also, they can manipulate child's own body parts to penetrate the child's own body parts. So maybe somebody will force the child's fingers to go into her own vagina. That also becomes penetrative sexual assault. Or even applying mouth with, even though it is not a true penetration, it will still come under penetrative sexual assault. Aggravated penetrative sexual assault is the same as penetrative sexual assault, but it is being done by a person who is an authority. For example, it may be a father, teacher, police officer, principal, armed force, security force, public servant who does these acts, so-called protectors. Then it becomes an aggravated penetrative sexual assault, whether it is management of a hospital, management of an educational institution, religious institution. We hear so many cases of those, gang assaults, even when the premise is within the police station or like a medical college or a college institution, and in the course of their duties, all of them come under the aggravated penetrative sexual assault. So we have spoken about penetrative sexual assault and aggravated penetrative sexual assault. Now we are talking about sexual assault. In bracket, I should say, that means it is not penetrative, but whoever with a sexual intent touches the private areas of the child or makes a child do similarly in any other person, or does it act with sexual involved without penetration, that comes under the sexual assault. And aggravated is the same touching of those body parts, but by a person, similar people who are in authority, and they do it with a sexual intent. It involves physical contact without penetration. So we have understood penetrative sexual assault and aggravated penetrative sexual assault. The second part is sexual assault and aggravated sexual assault. The third part being sexual harassment. So person is said to commit sexual harassment when they utter a word. That means somebody in the bike passes by a girl and calls her some name, or they make a sound, or they may whistle, they may gesture, put a bad gesture, or they may exhibit their own body part with the intention that this will be seen by the child, or they make the child exhibit the body part to another person. So even pornography is included under this act. So it may be showing an object or form or media for pornographic purposes, even stalking, voyeurism, following, digital videographing, all that come through in the sexual harassment, and enticing a child or give gratification. That means they reward the child for posing in the camera. That becomes all come under the form of sexual harassment. So these are the 5, and for each of them, there is a punishment which has been laid down, the POCSO. These are general guidelines. However, the amendment, which we will be looking at it later, has changed the first 2 to life imprisonment in some conditions after the Nirbhaya Act. And also, in some specific cases also, the punishment may change. That means it can be more than this, but it can never be less than this. So the main stakeholders are police, courts, doctors, psychiatrists, psychologists, counselors, institutions, foster homes, the Child Welfare Committee, and many NGOs. They are all stakeholders for us in the Act. So as medical doctors, for us, we are comfortable with our own psychiatrists, psychologists, counselors. Till then, we are comfortable. Even making a phone call to the police station is slightly uncomfortable for us. But we should have one coordinator who will in every institution. So we should have a policy, whether we are running a clinic, whether we are a part of a nursing home, or if we are in a bigger institution, there should be a policy as to how and who will deal with these sort of cases and who will deal with the stakeholders. Now, there are roles in POCSO told what the police should do, what the lawyers should do, what the Child Welfare Committee should do. We are focusing today on only role of the medical professionals. So very detailed role has been given. They have described quite well. Once it is read, it's very clear in POCSO what the doctor should do. And the medical professionals, of course, the role according to them is examination, treatment, and forensic evidence collection of the child to be carried out by a medical professional. And this should be done along with the parent or whoever the child trusts at that particular time. And also that the female child is examined by the female doctor. So the consent of the parent and assent in the older child is very important. So now in this, there are some issues what can happen. That means, for example, first one, if a child comes to a hospital and the mother says that 1 hour ago, I found her with some neighbor's room, and she came running to the hospital because she saw bleeding. Now, many times doctors do not examine, saying, go and bring a police report, go and register your case in the police station. That is the one which the POCSO Act has removed away with and said that whether the child is very sick critically sick, then of course doctors will manage. Even if it is not sick, a child abuse case is a sensitive case. So all history examination should be done without waiting for parents to go to police and bring a police report. That part can be done even after the documentation and examination and whatever treatment, whether it's psychological treatment or whether it's a medical treatment or some investigations have to be sent. After all that, the procedural part can be carried out. So that is important because many doctors say that child is not sick, child is comfortable, so let them go to police station. It is not necessary that they should go to police station. The doctors can examine, but write there what has happened. Just like any other medico-legal case, if a child comes, say, bicycle hit by a car on the road traffic accident, exactly how we will deal with the case, we have to deal with the child abuse case. And sometimes female doctor, for the third point, female doctor is not always available, especially in some places. So though it is not very well stated in many other legal explanations, it has been told that the male doctor with a female nurse or a female junior doctor or with a female supervisor appointed by the hospital, they can carry out the examination if child is sick. So the doctor should be, as somebody mentioned in the introduction, that the doctor should be well aware of the Pocso Act, what are the procedures, and being non-judgmental, empathetic. Then a detailed examination is important for by the doctor. And many of us are uncomfortable in examining genitalia, and the doctor should do a thorough, proper intellectual job. Also, how to treat pregnancy and STDs in under 18, formulate a medical report with diagnosis, and how to testify in the court when required, and they should be available for follow-up. So most of the doctors are worried about going to court. One is it takes away time. You lose practice on that day. And there we are just, doctors may be made to wait or not treated well sometimes. So all these are issues which are coming up, and many activists are asking for a easier verification for the doctors. But as of now, doctors have to go to testify in the court. Also, documentation is very important. This slide is not for explanation, but just like if we have not mentioned that a bruise or a fracture is present in a particular road traffic accident, they will not get the compensation or the treatment. Just like that, mentioning each and every aspect of the document, child abuse in the file or in the records is very important. Also, sometimes that we are supposed to use the child's own words. So the statement should be recorded by the police officer, not in uniform in the police station, but in the medical profession. The police should not be anywhere near where we are examining. They should wait outside. So any expert or adult, videos can be available if confidentiality can be maintained. It can be recorded in the child's home also. It should be recorded in the language of the child as spoken by the child. So if the child says that uncle touched my fufu, you have to write touch the fufu. And then in bracket, you have to write what a part of the body the child is referring to. So we should have asked that. We asked the child to show what is fufu, and the child showed in a doll that this area is fufu. So all that has to be very explained. Also, the frequent breaks should be taken. The child cannot be, rushed and said, okay, next, what happened after that? What happened after that? So the children just stop talking then. Also, medical examination should be immediately done, and it should be completed within 24 hours. Police officer should read the statement to the parents or child, and the child should get the copy of what we have written. Usually we give them after 24 hours. So many times it may be a cold case, and the evaluation by psychiatrists, psychologists, and follow-up care is very important. And family therapy and rehabilitation takes some time. Family reluctance may be very it's most common, and the family will ask you, doctor, is it possible not to make it a police case? So now that is the one which doctors find it difficult, and many doctors feel, yes, we should not make it a police case. So we are also part of the same society, and we also feel that if same thing happens to any of our children, probably we should not make it a police case, which is why we are not able to, as doctors, be non-judgmental about that and just follow procedure. We should understand that the society as a whole improves with reporting, and many protective aspects can be taken care of in policy decision, and reporting should be done. Of course, we want friendlier and easier investigations, especially with the police and the court. Also, awareness of POCSO is not present in family. They don't many times know that just because a boy touched, I can go to police station. They feel only if penetrative sexual assault has happened, only then we should go to police station. So 64% only were aware of the online complaints, and 70% were aware that hospitals do deal with the one-stop center. So for reporting, there is a mandatory reporting. Doctors must report with all the details. Failure to report is punishable, and naturally reporting is important because child feels scared and ashamed. Child has many, many years to live, and the child may later feel, oh, nobody took my side. I was young, but nobody punished the perpetrators, and responsibility lies with the adult to enter. So failure punishment can be up to 6 months. False reporting is also punished. Then the punishment is much more. There are special courts where the parent can be present with the child. There are cameras, so the child can be at home, and camera projection is done in the court via a link. And the identity of the child should not be mentioned in media. WhatsApp. I recently saw WhatsApp where the Calcutta person's name was mentioned, which should not be that case, though the media has given another name. And usually cases should be resolved within 1 year. However, conviction rate is still very poor. Also, there is some compensation for the medical treatment. Hospitals are supposed to be giving free treatment to child abuse cases without waiting for police case report. So that is extremely important. And the next line, refusal to treat is punishable under the section 166 of Indian Penal Code. Of course, I have not told the new Nyaya Samhita number, and it is present in the CRPC also. So it is important that we do not delay. Examine the child, see the child, even if there are no finding, document all of them, keep the record, stamp it as medical legal, and keep it with you. Okay, all the stakeholders, whether we should inform the police, we should catch the perpetrator, that is not under our purview. We have one police information has to go. That is all. Whether the police did not come and take it today, police, how should I inform? That procedures we should keep in mind. So there are 2 amendments which have been made in 2019. That is the penetrative sexual assault below 16 years, they have said, is imprisoned for life, along with fine, and even for aggravated penetrative assault will be either 20 years, not less than 20 years, or life. Initially, it was 7 years. So these are the 2 amendments which have come in after the some of the cases which have gone to the court. So in general, till now, we have summated the core essence of the POCSO cases. I know it's a little too much information at one time, but we'll try to see with our cases whether some aspects can be clear. So a girl under 16 years was forcibly taken by the accused, male accused, to his fields outside the village, where he has committed rape on her. And as per the history, the girl tells that it was a penetration which has happened. So can anyone tell me under what act of the POCSO it comes under? Is anybody ready to put it in the chat or tell me what type of POCSO classification? If somebody can read.
You can put your answers in the chat box, as Madam has said. I'll read it out.
Yeah, yeah. So there were 5 things we mentioned. It's okay to be wrong.
Penetrative sexual assault. The answers are coming in.
Yeah, so that's very good. So it is penetrative sexual assault, which is the happened to that case. Okay. A 39-year-old school teacher raped a 10-year-old girl within the school premises. Can anybody, and history-wise, it was that there was penetration. So can anyone tell me under what POCSO Act does this come?
And it would be aggravated sexual assault.
Aggravated penetrative sexual
Penetrative sexual assault.
Yeah, so it is just like the previous case, it's a penetrative sexual assault, but this is aggravated because of 2 things. One is he's a school teacher. Second, it is also within the school premises. So both ways it becomes an aggravated sexual assault. Suppose the attender does it, a school or a bus driver, school bus driver does it in the school premises. The school premise is a place where we assume that the children are protected. So any activity, any assault or abuse done there becomes an aggravated sexual assault. And here it is a penetrative sexual assault. So it comes under aggravated penetrative sexual assault. The punishment will be more for the case. So this is the POCSO case classification. We'll go to the 3rd case. The stepfather made the stepson see pornographic pictures. He also forced that son to touch his private parts. That is the father's private parts, and he used to masturbate in front of him. Can anyone tell me under what it comes?
Somebody has said it's sexual assault.
Yes, I can see Dr. Joshi has said sexual assault. It's a stepfather. Would you want to change? So stepfather is the protective person.
Aggravated sexual assault.
Yeah. It's an aggravated sexual assault where there is no penetration, but there is touching, and it is done by a person who is supposed to protect that child. So it comes as aggravated sexual assault. Next case, which these are common cases, only little modification from what we get. 2 boys on a bike kept following a 16-year-old girl on a relatively lonely road. I think, I don't know, nowadays no place is lonely, but yet these things happen. They kept touching her in between. Then they used to do a U-turn, kept pulling her dupatta. And at some time the dupatta fell down, and somebody has watched that. They were taking trying to take photographs with the dupatta. Then one person actually got down and attempted to kiss her. So can we tell what classification it comes under? So it comes under the sexual assault.
Sexual harassment.
Now here,
the answer is sexual
because
harassment.
they try to kiss and they touch the private parts. So if lips and breasts are or private parts are a thing, it will come under the assault. So harassment will be when no touching happens. When there is no touching, then it will be harassment. So the same case, I have just changed that. Suppose some stepfather made the stepson see only the pornographic pictures, did not make him touch him, or did not, allow him to touch, then this comes under sexual harassment. So it has been done by the stepfather or anybody, but it is no touching. It is only visual. So it comes under the sexual harassment. But the court can, even though it is sexual harassment, the court can punish similar to an assault. The court can take because it is a person, father himself, stepfather has done. So this is a 14-year-old girl. She visited a lady gynecologist for medical termination of pregnancy. She was pregnant. So the gynecologist has examined the patient, taken the consent properly, and she did not wait. She informed the police, but she did not wait for the police to come and say, okay, go ahead and do MTP. She went ahead and performed the MTP. And she did not preserve any samples for the MTP, for any investigation. Any comments on this? Is it the right what could have been done better, or is it the proper procedure? Could anyone comment?
Well, the consent, the girl cannot give the consent. The girl is not in consent age. That should be considered.
Consent should be considered, yes, because child is 14 years. So consent of one more adult is also necessary for the consent. So assuming that the gynecologist has, because she has performed the act, she has proper documentation of whoever is the consent, that should be taken. Should the doctor have waited for the police? Any comments for that? Any observations on that? Samples should have been preserved. Yes, 100%. Till we are sure that the police don't want the samples, we should preserve it. And in the hospital, we have preserved it up to 3 months once. Because the so-called abuse took place in some village, which is not in Bangalore, somewhere outside, 300 kilometers away. But they came to Bangalore to the hospital, and all the procedure MTP was done in Bangalore hospital. But the police station involved was the village police station. They have to come and take the samples. So we had to keep it in a deep freezer. Finally, we said 90 days are over, and then the FSL came, forensic lab, somebody police came and gave it to forensic lab. So samples have to be preserved for the MTP. What about
Ma'am, Dr. Shamik Ghosh here.
Huh?
Sorry, Dr. Shamik Ghosh here. Can I just put in a point?
Sure.
Yeah. So in this case, since it's a 14-year-old girl and the girl is visiting the gynecologist for an MTP, firstly, the registration under the POCSO is very essential. Secondly, is that before performing any procedure, I think so the Child Welfare Committee of that district also has to be informed, because it also involves keeping the patient safe. And only after the Child Welfare Committee gives the go ahead, only then the MTP can be performed, keeping the forensic laboratory. In most cases, it is the CFSL in the picture as to when the procedure will be performed and how soon the samples can be sent to the CFSL. So I think so there is a role for the Child Welfare Committee to be informed, and they have to be in the picture before the procedure is performed.
Okay, thank you so much for your opinion. But as per the procedure, or as per the government laid down rules, the gynecologist need not wait for police, CWC worker, or anybody to do the procedure. Many times they are 18 weeks, 19 weeks, and waiting for it goes, of course, now the court has extended it up to 24 weeks, but it is a burden for the child if the parents do not want the child, and 14-year-old should not be bearing children. So the reporting is very important. That is one which is important. So if the MTP has been performed without even informing the police, the message should go to the police. The phone call should be made to the police station. The message should go to the police. Whom they have conveyed the message should be documented. I have spoken to sub-inspector or constable, Mr. Gyan Ram. I have to write it down in my file, and I can go ahead with the procedure. So it is the role of the police to inform the CWC worker, not us. As doctors, we are not going to be calling several stakeholders, finding out where, what is going to happen. No. we can keep the child after the procedure in the hospital, and the next 24 hours we can find which is the safe place for the child to go. Does the child require to be discharged back to its own house? But if it is the same family member, then can it go to a, suppose, some cousin brother has done, paternal cousin brother, then can it go to maternal grandmother's house? So we can find out safe places, because our foster homes are usually full, overflowing, and it may be difficult for them to get a place. So if there's a family with which the parents themselves would, either mother or father would want to keep the child safely, and if the doctor is okay with it, then we can wait. Only thing is, samples should be preserved for once we have informed the police. If they have not come on the same day, we don't have to wait. Then the child should, now the part of this is, should the doctor take money from the child for this act? So as per the POCSO Act, ideally it should be done free. But many private institutions, for example, pharmacy bills, that means for the medicine and all, and if the child can afford, they take. If it is a government center, then of course the whole thing is done free. And there also, I think some medicines are brought. Now, what is important is, we cannot tell, go to the government center because you don't have money. That it is very important that we cannot do so if the parents are not willing and want treatment. So it is sometimes difficult in private institutions to handle child abuse cases who cannot afford such procedures. But it should be done just like we do it any other procedure. Also, under CRPC, this payment is an issue. And if we don't keep samples, it causes disappearance of evidence. So they may tell it is cousin brother, but maybe it is the father who has done the act. So if the FSL wants to see what is the DNA and wants to do investigation, we cannot take it as per se as to what the history is. So there may be need for further investigation. And sometimes after 1 year, 2 years, we are hearing the Me Too movement now in the Kerala film industry. So many times after many years, they come forward to tell what has happened actually. So seeing that the proper procedure is followed is important.
And then there are two questions in this regard. One
shall
is
I finish this case and we'll go to the question in the same thing?
Regarding this case, madam.
Okay.
Information to family members is a must in this case, or is it not essential? And do we do
no.
a GD with the police? Two questions.
What is GD?
A general diary.
Huh?
General diary. A general diary with the police.
What is general diary? Okay, let me inform the family member. Definitely we should share. Family members, we should have, they are our support people, and seeing, and of course we should observe the child trusting whichever family member that has come forward as, their body language and the way the child responds to them, asking the child privately, are you comfortable with this? It's very important to have family members on the side of the child and informing the child what has happened. There is no need to, one trusted member, we ask the child that, whom do you want us to talk to, and whomever the child says, then we talk to that person, and we should inform, and they should be informed that the child is pregnant or not pregnant, or what has happened. There is no need to hide it from family members. We are not going to be, as doctors, I will not be taking care of the child till adulthood, and the child may have various amount of psychological issues. So there should be a family member who's aware completely of what has happened. I am not understanding the general diary.
Madam, I think it's an FIR, I think.
Yeah.
I don't
first
know whether...
information. GD is not required, ma'am. I think, ma'am, I'm interfering. Yeah,
so I will tell you what we do in our hospital. So we have, ours is a medical college. So we have a CMO who is there. We make the file, as all child abuse cases are made mandatory MLC cases. And under, whether it's an OPD case or whether it's admitted, it is made MLC. Suppose they have not gone to the police station at all. They have first come to the hospital saying, oh, she came back from school and I found her bleeding in her panties and I immediately rushed her to the hospital. So there's no time for her to go to hospital, police station. So we have done the case. We have given her first aid. We have examined her. Pediatric surgeon, OBG person has examined. We have documented everything. We school, everything, just like, so and so happened. The child went to school at 9 a.m. This is the particular school. This is the address. That is where the child from 4 p.m. was picked up by the mother or auto rickshaw driver, name of the auto rickshaw driver, child came home. This is what the mother found. So very narrative history should be written. And then we document all of this. We inform our CMO. They make it a police MLC case and inform the outpost. Every medical college has a police outpost. So that police outpost is informed. They will inform the police station, or from the police outpost, somebody will come and gather detail. That is not, they will take the file and take. So they may come and ask me if I've forgotten something, I can refer to my notes and mention it to that person. And then they will file the FIR or as such. And if the parents say, no, don't make it police case, we don't know who the perpetrators, I have no idea what happened, then they are most happy to, the police are happy to leave it on B report. They have enough work of their own. If they have given some clues, and investigation will be carried out. And they may come to us at any other point to take the final certificate, which has to be produced in court. And if the court requires and is unhappy with our certificate, but they may call the doctor in person to the court to testify. So we have to have our records. We should have a very detailed, proper case history, pro forma, which is ready. Is that okay?
Yes, ma'am.
One more question, Dr. Ghosh.
Yeah, if the parents or the person who are coming along with the patient wants that it should not be done police case, then does it become necessary for the doctor to report to police? I think you've already gone through that.
So let us be clear. It is mandatory reporting.
Absolutely.
Whether the parents want
Absolutely.
it or they don't want it, we have to report it. So
Exactly.
what we usually tell the parents is that, so we do all the treatment, everything. The last stop is the CMO. There is no permission taken. I ask you for permission to do police case. No, it is information. So we'll say that this is a procedure we have to inform, and this is necessary by the government. Otherwise, I will also go to jail. You will also go to jail. So we will inform the police. If you don't want police investigation, you tell the police. They'll come and ask you, say, I don't want any investigation. Sometimes it's a consensual sexual act, where two 15-year-olds just wanted to explore themselves. It may be something which the parents don't want. They can say, we don't know who, where, child came back home and we have no idea who has done, and the police will document that and they'll say that they have no investigation. So we tell the parent that if they ask you and you don't want police case, you tell the police that you don't want a police case. From my part, I have to inform the police. So there will be no trouble for you. You don't have to take any fear for it. It is just a routine matter and we inform the police. Otherwise, as a doctor, you will be sent to jail. So it is not that this parent I will listen to, that parent I will listen to, third parent doesn't know what to do. Parents will not want to inform, always. So the idea is it should be always informed to the parent. So quickly going to the next one, a 14-year-old visited for MTP. This is the same thing. She was distressed and the ultrasound showed 18 weeks. So, you know, we are already nearing the time limit. Gynecologist refused. She said, go to the police station and come to hospital after filing a case. So I think we have discussed that we need not do this sort of, the last paragraph is completely against medical procedure. We should examine her. You do her routine, CBC, everything should be ready for MTP, admit her. In the meantime, sometimes, you know, you can inform the police and carry the procedure with proper, as I think somebody spoke that also in the child abuse policy, we should know where we should store samples, where we should collect our investigation. And forensic investigation in POCSO has a whole sort of nail clippings, hair clippings, clean white sheet, many things extra are required. All this should be available to the OBG and pediatric department. So we cannot refuse treatment. We can inform the police from the clinic. Doctor has to report. Proper documentation is necessary. Consents are necessary. Mandatory reporting and preservation of samples. All these aspects should be clearly kept as per the POCSO Act. So coming to the challenges and controversies, I'll very quickly take only 5 minutes and we are coming to the end of it. Confusion arises when the child or the adolescent refuses a medical examination. So parents will tell, no, examine her. We found she had run away with her boyfriend, and you examine, they have made a police complaint that the boy has kidnapped the girl, and they bring the child to the police station and say, you have to examine. They want to know whether the child has had a sexual attack or sexual assault or not. But if the adolescent or the child refuses medical examination, we cannot do forceful examination. So it is illegal even if parents insist. Unless there is bleeding and there is a threat to life or infection, only then maybe, with very proper documentation and why we are going ahead, then only we can do. Otherwise, it is illegal. So we tell the parent she doesn't want examination, we cannot examine. So in our hospital, we have one consent form. We have a refusal form also. So adolescent will say, I refuse for history, I refuse for examination, or I refuse for investigation. They may not want a cervical swab or a HIV test or anything. So any of the three she can refuse, or all the three she can refuse. So both forms are available. And so below 12 years, parental consent is definitely necessary. 12 to 18 years, both the consent is necessary from the child as well as the parent. And emergency treatment can be initiated without consent to protect, without consent, because it is important that the child's life is protected. Also, there is a controversy when under 16 or under 18, 16 to 18, very common is consensual sex. They say, oh, he's my boyfriend, he's my girlfriend. They are okay, or many times they may be married also. So regardless of consent, it is, however, criminalized as per POCSO. Many people, that is why they say, oh, it is consensual. How should we put it under POCSO Act? Now, many times we should be careful that as per the POCSO Act, the legal age of consent is set at 18 years. And consensual sex below, even consensual sex below 18 years comes under the POCSO Act. So reporting is mandatory. Now, just 2 minutes on why the government has not removed the 16 to 18 consensual sex from the POCSO Act is because of a terminology called grooming. So I'm not sure how many of you all are familiar with it. There is something called as grooming, especially when there's an age difference between the girl and the boy. So let us say a 16 or 17-year-old girl has had sex with a 24-year-old man. So what happens is there's an age difference, and the elder person is supposed to understand that below 18, it is not, it is against the law. However, with our population and the amount of illiteracy or of laws, at least, even we are illiterate about many laws. So a person may not know that this is illegal. That is also one. Second is, the person is not interested in that person as his life partner or anything like that. He just wants to have sex for some time. So there is something called grooming. For example, the girl is going to school, he'll say, oh, your school is very good, I can help you with homework. Or next day he'll say, I got this pen in my office, you please take it. And third day he can say, oh, your father scolds you so much, or your father is an alcoholic, I understand how difficult it is for you. So after some time, what happens now, a girl feels no one is my friend, this man is my friend. And this man is becoming her friend only so much so that he can have sex with her for some time, not with a serious intention. So that is called as grooming with sexual intent. So that is very difficult, because the girl will come and say, no, he's my friend, I like him. And the man will also say, I like her, because he doesn't want to be punished by the police. So this part of the psychologists only after some time, they will come to know. And hence, as of now, that has still been kept under the POCSO Act. Then medical examination, also female doctor controversy, challenges are everywhere. PHCs, it may not be available. And free, how do we give free care in private institution? Is there a policy? Actually, number of child abuse coming to private institutions is very less. But even for that one case, we make such a halla hula that sometimes we should have a policy in us. Mine is a private medical college, and they have taken up the child abuse under the CSR, that is the corporate social responsibility. So we are able to do magnanimous management and quality of the care. So just because it's free, we should not give low care. Also, doctors themselves, as with doctors, they don't, that's the biggest challenge. They don't want to see POCSO cases. They don't want to go to court. That is not part of my job. However, under the POCSO and more child abuse cases, all these come under our responsibilities also. So also the procedures in the police station that we should go to court. Why can't they do a video link with us? Why can't we sit in our clinic and give the testify without going to the court? Some of these things need to be addressed so that it makes it easier for us, and then procedures can become even more friendlier. So one don't, which is also mentioned in the POCSO Act, is no two-finger test. That has outdated, removed challenges, throw out of the window. As pediatricians, tell the gynae counterpart not to do two-finger. In fact, if you do, you'll be punished. Then training, we should train our doctors, nurses, attenders, and our graduates. It is part of our CBME, however, not complete. And also we don't have enough research or publications in it. So the key message as doctors is that we should follow the medical procedure, good documentation. We should work with the stakeholders. We should not have negative perception of oh, police are always like that. They will leave them. Oh, that foster home is like that. They must be taking money. I don't think we should work with that. We should have full trust in our medical, in our system. And I'm sure that the child will get justice. And if our notes and our procedures are good, definitely the child will get justice, and your caring hand will enable the child to recover well. So the pediatric, it's a pediatric case like any other pediatric issue, like a poisoning, snake bite, scorpion bite, elephant trampling, road traffic accident, and sexual abuse. All are medico-legal cases. And we should know the POCSO Act well, and we should know the forensic examination is something all of us should revise and probably have one training. We also teach our doctors in our institution to go to moot court. So we do a moot court, mock court, and they get more confidence after that. Okay, this is all that is. So thank you very much for giving me the opportunity. And with this time, I hope I have brought in some clarity regarding the POCSO Act. Thank you very much.
Thank you, ma'am. If you can please unshare. And
Okay.
it was just a fascinating talk by madam. And I think you have driven one point home. As pediatricians who take care of the pediatric population till 18 years, we have to learn about POCSO. We have to see the cases under POCSO. And I don't want to report, I don't want to see, it's nowhere there. So as pediatricians, I think we have to have that mental approach now, remove the mental blocks and face this POCSO as it has become an integral part of our practice. Thank you so much, madam. And I think there are some questions, if we can go through the questions now.
Yeah, I can see one question. What sort of training do doctors get to do a sexual assault investigation? I think all of us in our forensic were taught something about forensic investigation. And perhaps Indian Academy of Pediatrics, in all our conferences, we can have a workshop on examination so that more and more people can catch up with how to examine.
Ma'am, I'm Dr. Saha. I'm calling from UK.
Yes.
Yeah, it is his question, Dr. Bivan. Please go on.
So I think a very interesting talk and a very dynamic talk. I'm just sharing our practice here because I think this is something which is very much evidence-based, and this is something that ultimately goes to court. So from our practice that we do here is, yes, this is very an intricate training, and perhaps there should be a wing in every major city rather than everyone trying to do this. As this is very specialized, there may be evidence which you may not know needs to be collected in what way, because you are saying, what we are trying to say is there is a separate wing in every city of UK, which is known as the SARC wing, very much like a POCSO. And these cases are specifically referred to that wing, where there are specialists, because you don't want to examine a teenage girl twice or thrice, isn't it? So ideally should be examined once only. So there should be specialists who should be doing it. And suggestion from me would be there should be a specialist wing in every city rather than everyone trying to do it. Yes, our personal perspective is reporting to the police. However, training en masse doctors is probably not something we probably would envisage, because it is not everyone's job probably, isn't it? The legal part is, yes, everyone's job, but the training should be a part of a postgraduate degree or a diploma, where people will be trained on sexual violences, sexual acts in pediatrics. And that is how we can probably move forward. Otherwise, people will do it wrongly, and then evidence will get tampered, like a lot of things, and then we wouldn't reach anywhere with this.
Yes, so I do understand. Thank you very much. I think UK has one of the best systems, actually structured systems, which is there in place, and maybe nice to go and visit there sometimes. So doctor, please give us an invitation, then at least we can come and observe. The second part is, I think the number of cases in India with its population, the total number of cases, if the reported cases itself are so many, those under the iceberg, that is who never come up and report, are probably even more. So having, as you said, so that the government did start up with a one-stop center in many cities, which is established, and perhaps a city like, example, Bangalore, we have 4 one-stop centers. So including even in the other cities. So there's been an effort to have an all India number, child line numbers. There are effort to have online reporting where we can just put in an online form. But however, sending the child away to only to that place sometimes, because we don't have insurance here, the family has to pay for the transport, and they have to go back home after the investigation examination.
No, I do
concerns,
yeah,
but
I do agree,
understand
but this is something which can be suggested for child welfare.
I want to say something.
I don't think it can be privately funded. It has to be government initiated.
Yes.
And
Dr.
Apex center in every city probably will rather do the job. And you are seeing the iceberg because most of the doctors don't want to involve themselves in POCSO cases, and that's why they don't refer. If there is a center, then you will see more cases coming to the center. True. Because people who are specialized there, it works both ways, basically.
Yes.
Actually, I myself is Kalpana Datta. I want to say a few words about this. Actually, we are dealing with this from the long time. Where IAP, there's a chapter called I Can Sell, Indian Child Abuse and Neglect Medical Personal Data. I think Dr. Rao is also the member. We are also the member from that chapter. We used to have a workshop in different places, and even in the online also. There you can have lots of discussions, and you can learn the things about this. And about the 1 point center, we tried to establish 1 point center in Kolkata, but we failed to do it because of lots of issues were there. But I think many cities have a 1 point center where experts are there. All disciplinaries will be there. As Dr. Vikas is talking about the specialist, not only especially any medical personnel who comes in contact with the POCSO must inform, must examine, must preserve the sample. And madam said 3 months, but madam, I want to clarify it because our head of the Department of Forensic, he said 6 months. You hold responsibility to keep the sample for 6 months. And when you were writing the things, everything, name, registration, and please put on the one sellotape over this, because that may be torn, or that may be tampered. So always preserve the name and registration number in a plastic bag and keep it in the fridge. What we do practically that. And 1 point center in a government hospital, there is some administrative officer which is responsible for that. We used to inform them, he used to inform the police. But in the private setup or in the nursing home, each and every medical officer has to report the nearby police station. That's there, if there's no 1 point center.
Yeah. I think the legal implications are there. Something like a post-mortem, that cannot happen in a non-government center, isn't it? So why not a child abuse or a sexual, why will the government not take it up? It is like a post-mortem, basically.
No, it is there in the government. It is there in the system, the government. It is there.
The amount of postmortems done in government is too much load. So even many private hospitals are also come under the gambit. For example, ours is a private center which does postmortems for all the police stations in our area.
No, absolutely.
The work
there will be
is
very
distributed.
Few people who are exclusively trained, and unless you have that training, people will have that inhibition to go for it, basically.
I do wish that, one of my dreams is to bring in a postgraduate diploma or a certification or a higher level of training, so that we can establish wings like this more. Probably the next few years, we hope to get it. But as of now, such a training is only at MBBS level, right? Or for a pediatrician.
Yes.
We do not
Absolutely,
have any course or any certificate for child abuse specifically. So ICANCL also has not brought about, even under the IAP, we have not brought about a certified training. We have attended only workshops. We are not
Yes, yes.
telling them that you are certified examiners. We are telling them that you have attended this workshop. So we should probably one of the, in the
I think
future,
we can
bring
pick it
about,
up because we've got an IAP UK branch now and I lead it. So
Yes.
we've got an IAP UK branch now.
I am coming to UK in
Can I
October.
say
I do
something?
hope to
Well,
meet and
Can I say
understand
something,
more
it's a very
sir?
interesting discussion.
was
If
mine
I am allowed to speak here, this is a very interesting discussion. I must say that what is prevailing in India, it may be compared with, say, conducting a labor. An MBBS doctor may have to conduct a labor when he is working in a sub-center primary healthcare center. So, considering the population and lack of insurance and the transport issues, this system is now prevailing in India. Ideal situation, what Bhivan is saying, is definitely UK. That is nationalized health system, and that could have been better. But what is prevailing now, what we have to do now, that we are discussing, that we should be able to do it, and that responsibility lies with us. This doctor,
So just wanted to
not a
add here.
pediatrician.
So just wanted to add what Dr. Sukanta sir is saying. Actually, Dr. Vivan, that the government has taken up this initiative to train medical officers in the government sector. In the government sector, because they are not confident enough, the guidelines and all that. So they have taken up serious training of all MOs in the government setup to take up these cases. So some part of training has been done. Maybe they are still not confident enough, but training is going on. So for
No, but I understand what doctor he's telling is that it's like we refer an pediatric oncology case.
Yeah, I understood what
so
he's
you have
saying.
few trained people who can manage the whole thing. Other people understand and do the primary procedure.
Yeah, I understood what he's saying. Yeah.
Can I talk?
Some training is happening.
What is our experience? Usually this child sexual abuse is done by their own people, not strangers, what we come across many times. And that time we find a lot of challenges for us to tackle that. So where to shift the child, how to protect the child may go back to the same atmosphere again. So that situation is the thing which usually we tackle in the private practice, when in a private setup. And that is a very difficult thing. And how to tackle those things, you should tell us.
What I feel is, as it is, it's an overwhelming problem when we see a child abuse. So as doctors, I feel first part is to focus primarily on the medical aspect, medical care, medical examination, psychological care, psychologist examination. What happens later? Does the police take them? We try to find a safe home, but if I am not working as an activist or as an NGO outside. So what I have done in Bangalore, I have 2, 3, 4 NGOs who are in my network. And I say this child stays near a home. They even do home visits to such places. So we try to see how otherwise we give, or we see that the police informs the CWC. Of course, now
Child Welfare
years of
Committee.
working, I have the CWC number. So
Yes.
I say, look, I've informed the police. So she'll get information. She may also visit. So we try to extend, but that is not my primary concern. Oh, is she still being abused at home? Next visit, we try to understand, but if we start doing outside the hospital care, then I will not be able to concentrate on what I do when I see the case. So I feel that we should have the network of people who will take, or a good people, social workers who will go and see the patient, where we hand over that aspect of responsibility to them. We see that follow-up. Many times follow-up is a problem. They don't like to come to the same hospital where they have been identified as an abuse case. So that is one of our also challenges which we face that. So we try to maintain contact and give the medical care to the whole situation is what I feel is the best way under the present circumstances.
True, I
Child
think
Welfare
committed
Committee
network
has
is
a duty.
required. Committed network is very much required.
Madam, one is asked about the boys. I think the answer is the same for both the sexes. No gender discrimination.
Is there some question asked?
Yeah, it was
They
asked
said
in the chat
if there
box.
is any specific for boys, but as you said, it's gender neutral.
It's the same procedure. Everything is the same. We
Ma'am,
have a
if I can
paper
just
on.
come in once again, I'm sorry to be interrupting. This Child Welfare Committee, I mean, this is from personal experience also, that they do play a very, very important role because immediately after discharge, if this child is discharged into the same adverse environment, like Dr. Gita Patil just pointed out, most of it is within the family or in the neighborhood. So that is where the Child Welfare Committee, and my experience is that they do not take long. The moment they are informed, they usually conduct a teleconsultation also with the family. If the child cannot be taken or the parents are not in a position to go to the district office, they do conduct a teleconsultation and they do give us suggestions prior to the discharge of the child, because ensuring the safety of the child also becomes part of our responsibility. So that is why when I had previously interjected and I had talked about the CWC, they do have a very important role to play because
No,
from
yes,
all
I
angles.
agree with you, doctor. They have an important role, but it is not necessary that if I have not informed them, I should not conduct my
That police will
proceedings.
inform
That is
CWC.
the aspect I'm
The
saying.
police,
They have a very important
yes,
role.
the
The
police,
CWC has sent people to stay in the hospital with the child because the mother had to go home for some time. So they take
Absolutely.
a lot of care and they offer a fantastic support for the amount of salary that the CWC worker gets. They do a tremendous job. And they are very prompt, as you said, doctor, that once you inform them, they do come. What I meant is it's not necessary for a judicial permission
Yes.
from them for
Yes,
me to
that's right,
conduct my treatment or procedure.
Ma'am,
Yes.
They are definitely very,
I-
very facilitative support.
Yeah, they are facilitating, but maybe I might be wrong, but this was my experience with the case that prior to conducting an MTP, right, we were told at least from the administration over here that permission was required from the CWC because it was not a
No, no.
life-threatening condition. So
No.
but for the simple reason that once the procedure is conducted, thereafter the child will be eligible for a discharge. So that is why the CWC, in fact, they had listed out in that order that once the procedure is conducted, once the samples have been preserved, then the child will be sent to so-and-so place, and it was a foster home. So I might be wrong or things may have changed because my experience was about 5 years back, okay, in 2019. But what I personally feel as a doctor, leaving aside everything else also, that the CWC has a very, very important role to play. And the other point which I would want to emphasize is like what Bibhan said, is that ideal would be one-stop centers. But like what Professor Chatterjee just now mentioned, Professor Kalpana Doctor also mentioned, that the logistics of our country do not allow us to have these one-stop centers. So whatever establishment we are working in, we should enlist the help of the hospital gynecologist, the hospital psychiatrist, if there is a clinical psychologist available, to be part of the team that is first hand tackling this particular case. Then a lot of the rough edges, which Bibhan was pointing out regarding accuracy of examination, accuracy of findings, they can be reasonably trimmed and we can get a fairly good report if there's a multidisciplinary team which is attending to the child.
I think, and Dr. Shami, yeah, one thing I had to like, if anyone
Dr. Ghotok, please mute yourself. Dr. Ghotok, please mute yourself.
anyone has
Please
worked
go
in
on.
the health services, everyone knows how to write an injury report. Similarly, it is a total physical examination and a writing like an injury report, you know, in your undergraduate days and you also in the internees and when you are doing the trainings. So only the legal part you have to know. There's no need to extra training because you are examining the thoroughly daily pediatrician, you are a pediatrician, you are examining everything and you are writing the injury report also. The same thing here, but one thing that is Dr. Rao madam has clearly mentioned, you have to inform the police. That is the, you should not forget it. You do all the medical things, whatever you do, but you must mention inform the police and the further work will be done with the police, CWC, child welfare, NGOs, government, whatever they will coordinate and do, because that the doctors are very busy, one after one patients and all, whether you're in a chamber, in the hospital and where. So it's not possible for a doctor to follow whole thing for a particular child. So if you inform the police.
I fully agree,
Yes.
Dr. Kalpana Datta, but I think what Dr. Shamik Ghosh was trying to say that his experience. So maybe that particular CWC staff was very cooperative and helpful. That's why he remembered that incident. But
No,
otherwise,
sir,
it is not
is very
our
cooperative.
compulsion. It is not our compulsion that we should inform. That
CWC
is what
very
Chandrika has told, and that is law. And that is, I think, the message of this whole discussion. Well, I again invite Ashim to.
Madam, there was another
proceed
question.
further.
In private practice, how do we preserve the forensic samples? There was a question there in the chat box.
Yeah.
In private practice.
Yeah, it's very difficult to preserve the samples in a private, unless you have a freezer of that particular temperature and you have to keep it. So, and you can take help of a nearby center. So networking is very important, and saying hello to each other. And so many of the private pediatricians also in our own area, they see the case, we say, write the primary document and send the patient to the medical college. So
Yes.
the colleges do handle it on that, so that they don't have to take up the major burden. So we are unofficially working as a one-stop center for our area, but however, it needs to be more structurized and formalized, and preservation of samples needs to be done. We can inform the police that I've kept it in so-and-so hospital. You can write to the superintendent, please preserve it with this sample. And we can ask the police themselves where to preserve the sample. So from private, they will take it away. They will not keep it. They know that bigger institutions have a place to preserve. So FSL is also hugely burdened. They are doing backlog of so many other cases. So that's why these samples take time to be collected. But so we can use other avenues. We can take the sample to the police station and ask them, where do you want me to preserve it? So these are one or two of the things that we can use.
Madam Rao, as you were saying, your dream is of having a certified course.
Yeah.
We have someone from CIP here, or the National Treasurer. So we can ask CIP to look into it, and if some courses can come from the college, the IIP College of Physicians. Dr. Bhadra, your take on it. Dr. Bhadra.
Atanu sir.
Atanu Bhadra.
Atanu sir.
Dr. Atanu, bhai.
Atanu sir, comment.
Yes, sir.
There's a request for Central IP to start a course.
Certified course.
Okay.
If
We'll look
Central
into
IP considers it, right.
We'll look into it. It will be in your
Very
time.
clever answer.
It will be when you will be chairperson. Geeta ma'am will allow it.
Yes, sir.
Amol, there's a joint national
Dr. Amol
coordinator
is
is
there.
there, so he will organize it.
Okay.
So
okay.
it's a
We'll
request
forward
from
to
the AHA, yeah, to ICP, yeah, correct.
Again, there's a question from Joshi. You just see Dr. Ashim.
Yeah. Is there any group or helpline where we can get
We are
advice?
also looking into the pulmonology courses now. So I think the next would be logically should be adolescent.
Helpline for what, sir?
Advice in such cases. I think a helpline
The
for the pediatricians.
iCankle had made some helpline. We can ask Dr. Rajiv Sheth to forward those numbers.
Yes, yes.
Yeah.
Otherwise, the child line 1098 also gives us guidelines, and they are pretty much well responsive. We can ask them also that I have seen a case, what should I do? They guide us very well through that. The only problem is they should lift the phone, but they have a lot of workers, and it's pretty well run compared to the many other helplines. So this also, there is in the Central Women and Health Ministry, Women and Child Development, there's an email ID which we can send our doubts also.
Any online port is there, Chandrika?
That's what, online port to inform that so-and-so child is abused. Even child can write on that online port. So in foreign countries, they have stickers at a lower end where only child can see. that if you're abused, inform this number. We don't have such sorts in UK. I've heard in Europe and all, they have certain things only at a lower level. So adults will not be reading those messages, that you can inform this number if you're being abused, if you're being physically maltreated, like that. So here 1098, and there are online numbers and portals. Since
Thank
it
you,
was
madam.
POCSO Act, I didn't put in all those things. Otherwise, in child abuse management, we put in all the phone numbers, networks, and all that. So,
Madam, this animated discussion can go on and on,
yes.
but I think we've got to stop somewhere, and
Yeah.
we might have another program in the near future. I would now ask Dr. Chompok Das, the chairperson of WBHA, to give a vote of thanks. Dr. Das, please.
Thank you for joining, everyone. And Dr. Amol Pawar has already shared the numbers, the child helpline numbers, child and Sampark Help Desk. I will share in the AHA group. Please follow this till we can get matured enough to deal all these things. So thank you joining for thank you all for joining this enlightened session. POCSO is a debatable situation. I have talked to Ashim Ghosh yesterday also, because it's neither of the other, and really we need to know a lot. So thanks for joining this session. All the national dignitaries, all the state dignitaries, Dr. Kalpana Dr. Shukanta Chatterjee, Dr. Geeta Patil Madam, Dr. Chandrika Rao Madam as speaker, Dr. Amol Pawar Sir, and everyone, thanks for today and good night, and we shall get back again with the same thing, I think.
Thank you, Dr. Chandrika Rao, Madam.
Thank you.
Excellent program. Excellent.
Thank you.
Excellent.
Thank you.
program.
Very interesting discussion.
Yeah.
Thank you.
Excellent program.
Chandrika, as expected, good.
Thank you very much.
Thank
Nice.
you.
Thank you.
Thank you.
Thank you, Ashim.
Okay, good
Ashim
night,
Ghosh
Thank
and
you,
Dr.
madam.
Champak
Thank you.
Das
Thank
ji.
you.
Thank you.
Thank you,
Thank
LNG
you.
friends. Yes.
Thank you.
Thank you,
Good
Dr.
night.
Nice to see Dr. Amol and Dr. Atanu Bhadra sir.
Thank you.
Bye.
Bye.
Thank you
Bye.
all. Good night.
Bye.
Bye. Good night.
Bye. Good night.
Good night.
Sharma sir, thank you.
Bye bye, ma'am. Thank you.